My name is Nerys Frater. I'm a GP in Carmarthenshire, West Wales. I'm the founder of this lifestyle clinic, which is my own small business where I support and guide people to lose weight and reverse pre-diabetes and type 2 diabetes. This all started because I felt frustrated. I still feel frustrated, in fact. I don't feel that I'm able to work my best in the current climate in the NHS. Patients feel frustrated, you can't get appointments, you can't get to see a doctor, the repeat prescription messes up, you're waiting years to see a specialist. I get it. I know it, I'm living it too. And I can tell you it's not great on the other side either. I signed up to medicine to help people, but the sheer volume of patients stops me from doing my job well, and that's why I'm here. Because I realise that if I can create courses and talks, I might be able to help more people take control of their own health. And that's what I want. People are so healthy that they don't need to see their doctor. I realised a long time ago that how we do things currently doesn't work for most chronic disease. A chronic disease is a condition for which there is no cure. Things like high blood pressure, asthma, heart disease. We're medicating lifestyle illnesses, and this isn't right. We're way too stretched to get to the bottom of the problem. We're too overwhelmed to think differently. And whilst I struggle to get everything done on the NHS, I still want to do things differently. And it was back in 2018 when I first had the inspiration for this clinic. I was doing a morning surgery and I realised that most of the illnesses I was seeing was down to something called inflammation. Inflammation is like an irritation. Our bodies are in an irritated state, not just a psychological thing, but internally in our bloods and organs. And this low level of irritation is caused by the foods we're eating, chronic stress, lack of sleep, less time in nature, less community support, our lifestyles essentially. And you see it with conditions such as high blood pressure, fatty liver, and diabetes. Leads to heart attacks and strokes. But also things like feeling tired all the time, people with recurrent infections, joint pains, low energy, feeling tired all the time. These are the main conditions I see as a GP. And the main cause of inflammation actually is just being overweight, because fat is actually an organ. It releases chemicals and hormones, and it is these that contribute to illness. Being overweight or obese is actually a hormonal problem. It's nothing to do with being weak or lazy or greedy. And when I started doing my clinics, there wasn't much available on the NHS. I'm glad to say that there's now a growing interest in the field of lifestyle medicine, and more clinics are popping up all the time. But people tell me they need step-by-step guides and motivational support to make changes. They want support from both healthcare professionals and others in the same situation, so people that understand what they're going through. And that's essentially why I started this clinic. It's centred around weight loss, but we've got expertise in treating type 2 diabetes and pre-diabetes. Because a lifestyle change can be so powerful that blood sugars can drop within days, certainly within weeks, and they can continue dropping after months. Knowing which medication and the dose you should take, it does need expertise, and we've got the time and knowledge to be able to do that. So we've become experts in de-prescribing. And of course, we can see people every week, so we can really support, which is a huge frustration on the NHS. And what we're doing is using lifestyle as medicine. But the field of lifestyle medicine itself is essentially a focus on how our environment affects our health. It's a fascinating field, and it takes the focus away from the doctor prescribing medication, but focuses on empowering you to take control and incorporating skills into your own life. But more importantly, it's about treating the root cause of the illness. So for example, with type 2 diabetes, when a patient would come to a doctor with symptoms of high blood sugar, they might be feeling thirsty, passing a lot of urine, and if the blood test showed their blood sugar to be high, then we as doctors would automatically prescribe medication to bring it down. And rightly so, because if there's one thing we do know, it's that high blood sugar will make people ill. So we do need to bring it down as soon as we can. However, bringing down the sugar is actually only treating the end result, the symptom. The high blood sugar is a late sign that things aren't right with somebody's metabolism. So why is the blood sugar so high? And it's because the pancreas is exhausted. Why? Well, because it's been trying its best to release enough insulin to keep the blood sugar down for years and years, decades even. And it's burnout that causes the pancreas to fail with type 2 diabetes. And it seems simple. So instead of treating the high blood sugar with medication, the focus with lifestyle medicine clinics is to address the root cause, and the blood sugar will improve as a result. If we look and focus our attention at treating what is causing the disease in the first place, then we do way more to really treat the illness. And it's not just diabetes I'm talking about. Obviously, my interest is pre-diabetes and type 2 diabetes, but when we do implement these techniques, we see other conditions improving at the same time. Blood pressure, fatty liver, cholesterol, all of those. As a doctor, we often focus on what we can prescribe. And yes, let me be clear, medication does help, and I do prescribe a lot of medication in my NHS clinics. But doing this programme has made me realise that actually the way we live our lives is what's making us ill. And it's not a judgment, we're all living in the same environment. So what I do is help people understand what these things are that's causing us to be ill, and how the little things you can do over months, years will really lead to a huge, huge impact in your health. So welcome to my world. If you're somebody that's ready to change, who's open-minded, open to new ideas, up for a challenge, then please do subscribe to our social media and take a look on our website. I've got loads of videos, loads of knowledge, loads of downloads for you to get that knowledge up to scratch.